computer. While we're printing.
This is why nobody likes the map. What just happened here? I'm so glad I'm not like that.
Okay, so I'm going live. Anybody who's got other stuff going on in the background may want to mute. Go ahead and mute. I'm going to mute all of us. Okay, Mary, it should be up and rolling on Kansas Poor People's Campaign. Double check for me that it is. Yes, that looks right. We are on. Welcome everyone to our Kansas Poor People's Campaign, Kansas Interfaith Action and Medicaid Expansion Coalition live stream press conference. We're waiting a few minutes to begin. We wanted to make sure that we had made it into the live stream. So we hope that you will share this link with other folks who want to hear from our speakers this morning as we get ready for the Kansas State Legislature to come spend a day of business tomorrow, trying to close up what they're working on and finish business for the legislative cycle, which has been interrupted by a pandemic. And most of the work that they were doing has not happened. So most especially Medicaid expansion, which many of us were hoping to see happen. So we have some guest speakers today. They're going to share with you about why we think this is important to still pay attention to and why we think our legislators should come back and do something. So hang tight with us for a few minutes. We're scheduled to begin around 11, and we look forward to sharing with you this press conference. And while we're waiting to begin, we may also share with you that we have some other things going on this week and ongoingly. So I'm going to ask Mary Akerstrom to help me remember some of the things that are happening this week that we might want you to pay attention to as well.
Thanks, Sarah. So I'm Mary Akerstrom, she, her, hers. I'm here in Topeka. Some things that we have going on this week with the Poor People's Campaign is a selfie challenge to start off with. We want to know how you've been affected by COVID and how Medicaid expansion could have helped you, dear watchers and listeners. And you know, write it out, just write it out on a piece of paper and take a selfie and share it to Facebook. Tag us at Kansas PPC. Our other stuff coming up, we're gonna get in early tomorrow morning to the Capitol building, 7 a.m. to greet our legislators as they come back to work for that one day. We're hoping to run into some friends who are also as disappointed as we are about the lack of wherewithal from leaders in the Senate to expand Medicaid. So it might feel a little bit like a morning ceremony like we had last year. Coming up also, June 20th. It's right around the corner. We're so excited. We're uniting 140,000 poor and low wealth people across the nation. We're all going to be together that one day on Facebook, June 20th. Folks who don't have Facebook can go to poorpeoplescampaign.org and get linked in that way. I'm really looking forward to June 20th because I feel the groundswell these days.
Thank you.
And I think that's all we have coming up. If you can't be with us at the Capitol tomorrow morning, be sure to call and email and flood the lines at the Kansas legislature tomorrow because they're only coming back for that one day.
Let them know what you think they should be getting done, how they should spend their time.
And let them know you vote.
That's right.
There's our power. It's all in the vote.
So it's straight up 11 o'clock, and I want to welcome anyone who's watching to our press conference as we prepare for legislators to return to the building for some end-of-year business. And similar to last year, we are very disappointed in what's been happening. I'm going to give a couple minutes for members of the press to join us if they can, and that way they can ask questions directly and be part of this. I see Corrine Griffith has joined us. Corrine, where are you, when you're able to share with us, you can tell us where you're calling in from. So that's what we're here to do. Like I said, we're going to give a couple minutes for press to get on the call. Corrine, let us know where you're calling from or where you're arriving to the Zoom from. This is Reverend Sarah.
I'm from KSNT News.
Great. Thanks for joining us. We really appreciate it. We are live streaming through Facebook right now, and I'm also recording the conference. So if you have questions at the end, just feel free to let us know. All of us will be happy to answer questions as well. In a moment, we'll begin with me. We'll move on to Chris Overfelt, and then we'll have Ian Quincy, and then Renee Cool. So each of us will speak just for a few minutes about what we hope to see happen with Medicaid expansion and why we think it's so important. So that's what we're here for, and we'll just give probably one more minute for anybody else from the press to join in who maybe, you know, we don't have street traffic so much to get to our meetings anymore, but we have Zoom traffic. The complexity of getting to the right link on our computer and making sure that we have all the other pieces in front of us. It seems like it should be simpler to be working from our homes, but somehow I think it's actually become a little more complicated, at least in my house. So. Well, Mary made some announcements at the beginning of this. We'll try to repeat those at the end for those who come on a little bit later, so folks know what else they can be involved in that is happening right now. Lots of issues related to COVID-19 and its impact on our communities. Healthcare is certainly one of the largest areas that we have concern about, but there are certainly other ones, including housing. So keep in touch with us after this. Okay, I'm going to go ahead and get us started, and hopefully I'll also notice when people want to be let in through the waiting room. So last year at the end of the legislative cycle, I called out, Lord, hear our prayer. We need health care. Lord, hear our prayer. We need health care. And as a pastor, I believe that healthcare is a human right and that our religious traditions value human life as sacred and worthy of our protection. And in my tradition, we say that we believe in the inherent worth and dignity of all human beings. On the last day of the state legislature's 2019 calendar, on May 29th, I stood up with 8 other Kansans and interrupted the state synod. I interrupted with prayers and singing, a lamentation for the incomplete work of this body, and its refusal to expand Medicaid in Kansas again. All through the legislative season, we had tried to capture the attention and hearts of these legislators. We greeted them as they came into work at the entrance to the parking lot. We set up meetings with them inside the building. We attended rallies and hearings and wrote letters. We have been doing this for over 3 years. We returned to this work again in 2020, hoping that new support from leadership would move expansion forward. And then COVID-19. We know that even before the global pandemic, without expansion, people were already dying because they weren't getting to the doctor soon enough and they couldn't afford the medications and procedures necessary for their health conditions. And research has shown that out of the 150,000 or more people who should get Medicaid in our state and could in most other states, about 627 will die every year. I want us to pause and just ask, what will the death toll be now? Others are surviving while ignoring preventative health measures because they don't have access to health care or putting off important steps in managing their own health. This leads to higher costs for all of us because folks use the emergency room for routine health care and end up with more serious conditions that cost more to treat. And folks, it's a morally bankrupt system. Healthcare is a human right. Out of 50 states, we are one of only 14 that haven't expanded Medicaid. Why? Because some of our legislative leaders would rather stick to a narrow agenda that serves very few of us than admit that we need to expand Medicaid. We've lost access to rural hospitals and billions of dollars for this narrow agenda. I don't think that expanding Medicaid will 100% fix healthcare in Kansas or in the United States. There's much more for us to address if we want to create healthy, sustainable futures for Kansas and Kansans. Many of us who have insurance still have medical debt, and we can't pay and put off care because of high deductibles and hidden costs. We fight with insurance companies over the cost of prescriptions and whether the one our doctor prescribed is covered. But the first step, the very first step in addressing these issues is expanding Medicaid. It will increase the number of people with insurance and therefore create healthier communities across the state. It will increase revenues and stimulate our economy, and it will stop some of the bleeding that we are experiencing around healthcare costs, which have only gotten worse in the last 2.5 months. The Kansas State Legislature still has an opportunity to pass a clean bill for Medicaid expansion and apologize to Kansans for not getting it done sooner. We're in the middle of a global pandemic. Having access to health insurance and medical providers couldn't be more important than it is now. The time is now. Lord, hear our prayer. We need health care. And with those remarks, I'm going to pass the baton over to Chris Overfelt, who's joining us from the Kansas City area. Go ahead.
Can you hear me?
Yes, we can hear you.
Okay. My name is Christopher Overfelt, and I live in Gardner, Kansas. I served in the Air Force National Guard in Topeka, Kansas, from 2002 to 2011 as an aircraft hydraulics mechanic, and I deployed to Turkey and Qatar in 2009 in support of Operation Iraqi and Enduring Freedom. When I left the military in 2011, I began experiencing severe anxiety, and I was able to access treatment through the VA hospital in Kansas City, Missouri. To this day, I continue to have access to health care through the VA, and the care I receive there is top-notch and something I consider to have saved my life. The reason that I still have access to VA health care is because I qualify for federal Medicaid. I do not qualify for Medicaid in Kansas, but the VA is a federal program, and so it follows federal requirements. I cannot overstate how valuable having this access to health care is to me and how much it improves the quality of my life. I am truly thankful that I have access to socialized medicine and the benefits it brings with it. To think that we have the capability to provide this level of care to all Americans, but lack only the political will to make it happen is a travesty. Sadly, American politics are governed not by the will of the people, but by the pocketbooks of a few powerful corporations. Last year, the CEO of United Healthcare, one single person, received a total compensation of $18 million. United Healthcare, Blue Cross and Blue Shield, Cigna, and other health insurance providers all lobby our politicians heavily to ensure that our outdated and unwieldy healthcare system does not change and that their profits continue to flow. This applies to both Democrat and Republican politicians. The United States of America spends over $1 trillion a year on war, but lacks the political will to save the lives of its own citizens. Since 2001, the beginning of the War on Terror, the United States military has dropped an average of 100 bombs every single day, bombs and missiles that can cost $100,000 each. And what results have they produced? More war, more terrorism, a never-ending cycle. During my time in the military, I experienced firsthand the futility of the War on Terror and the travesty of military spending. We must, as citizens, come together, Republican and Democrat, and fight the war machine and end wasteful military spending. And we must end the corporate tyranny that has a death grip on our society right now, and do away with harmful companies like Blue Cross and Blue Shield, United Healthcare, and Cigna that put barriers between people and their health care for profit. We have the capability to expand Medicaid, not only in Kansas, but all over the United States and to all of its citizens. It is only a matter of priorities. Right now, the American government's priority is on the profits of the corporations who control it. It is up to us to change these priorities and put the lives of our friends and families ahead of corporate profit. Thank you very much. And Reverend Sarah, I have to get off the phone call now to get back to work, but thank you for allowing me to share my testimony this morning.
Thank you so much, Chris. We appreciate your words and your ongoing leadership on these issues. Okay with you, we'll put reporters in contact with you if they need to follow up.
Yeah, you can give them my phone number if they need to.
Great. Thanks, Chris.
Okay, thank you.
We are also joined today by Ian Quincy, and I'm going to let Ian take the floor from here and share some thoughts from his perspective.
Hi, can you hear me?
We can. Great.
This is Ian Kinsey, and I represent Kansas ADAPT. ADAPT is a grassroots advocacy group for people with disabilities all around the nation, and we believe that Medicaid expansion is very important for people with disabilities because it is what funds most of our services that we need, and we believe that expanding Medicaid will help with the shortfall that we are currently experiencing in the area of personal assistance services. We believe that if we expand Medicaid, that our workers will be able to be covered under Medicaid so that they will have benefits when they come to work for people with disabilities. Also, people with disabilities will be served more when Medicaid is expanded because it could possibly fund the waiting list so that more people who need personal care attendants could be served by having Medicaid and getting rid of the waiting list. And also, just people with chronic health conditions also experiencing a disability need healthcare coverage so that they do not die from the lack of healthcare coverage that they don't have when Medicaid is not federally funded. And as Sarah had mentioned, we do believe that healthcare is a right. In the Constitution, these inalienable rights are life, liberty, and the pursuit of happiness, and you cannot have any of these inalienable rights without healthcare throughout the nation and in the United States. Thank you.
Thank you so much, Ian. We really appreciate that perspective. It's so important with these issues to be aware of the many different ways that we're impacted by the lack of health care. And I'm going to introduce Renee Kuhl, who's going to share with you more about the experiences of people who are unhoused and staying in shelters and in need of Medicaid expansion. Renee?
Hi, Sarah. Can you hear me?
Yes, we can hear you.
Okay, great. Hi, thanks for having me, guys. My name's Renee Kuhl. I'm the executive director of the Lawrence Community Shelter. We serve individuals and families experiencing homelessness in Douglas County. We currently serve up to 48 people per night. We've got reduced numbers due to the COVID-19 pandemic. We've been working really hard over the last 2 months to make sure that we're providing a healthy shelter environment and environment where people can access shelter who are experiencing homelessness and where they won't be at increased risk of transmission of COVID-19, where this is a safe place during this pandemic. But the best thing and the safest thing for them would be if they were able to be assured that they could access healthcare right now. That's the most important thing right now in the middle of a pandemic, is knowing that if you have symptoms, if you've been exposed to COVID-19, that you could go to the doctor or the hospital if you needed treatment, and that it would be paid for. And everyone experiencing homelessness in Kansas is entitled to, should be able to access Medicaid. I think it's cruel and inexcusable that another session is going to go by and that Kansas hasn't dealt with this. We could have had this problem solved in January, before the pandemic even started. This could have been solved. And I'd love to just walk you guys through what it's like for us trying to mitigate the costs of providing healthy shelter in the middle of a pandemic. When folks need to get tested, sometimes we're able to access free public health tests, but the rapid testing, the emergency room, the pre-test that they put you through, when we've had guests or staff screened, they have to be tested for flu and a number of other things, and every single one of those tests costs money. Every one of those office visits costs money. When we have to wait a long time for the test results to come back sometimes. So guests have to stay in a hotel because we can't allow them to be here in a congregate environment. That costs us money. All of that for people experiencing homelessness could be covered by Medicaid, and it's not. And that's unjust. And we spend thousands of dollars a year as a nonprofit organization subsidizing the cost of copays and covering the cost of office visit copays and prescriptions for our guests, because we believe that it's their human right to access care. We don't think that that poverty should be a barrier to care. And to attempt to navigate a global health crisis without, care that the folks in Kansas who are living in poverty are entitled to. It's already been federally allocated and awarded to them. There's no reason for these barriers to exist. To have to navigate that in the middle of a global health pandemic is cruel. There's no other word for it. And we need this to be fixed now. We can't wait another day. So I would just urge, Democrats and Republicans in the Kansas State Legislature to get it done. If there's 24 hours left, get it done. If there's 12 hours left, get it done. It was done in January. And instead of sealing the deal, elected officials played games, and then we were stuck with this global health emergency in which people who are in poverty, who have the highest barriers to accessing Medicaid in this state, are also the people who are at the highest risk if they are exposed to COVID-19, or they're the most likely to be exposed to COVID-19. So you have stacked the deck against them by failing to do your job 5 months ago. And a deal was on the table. It got trashed for no reason. And now here we are. And I am paying thousands of dollars. My organization is paying thousands of dollars. Our community has to have made donations to make it possible to ensure that people experiencing homelessness can get tested, if people, we're lucky we've had no positive cases, but if we had a positive case, if it was someone who didn't have Medicaid, I mean, I can't imagine what the cost of their care would be if they had to be hospitalized because of coronavirus. So it's very scary for us, and it's not at all sensible or logical. It's just cruel that this is not, been brought over the finish line. So just on behalf of the people that I serve, on the behalf of people in Kansas who are living in poverty, who are rent unstable, who are housing unstable, there's so many more thousands and thousands of people in that category now than there were 2 months ago because of the high unemployment rates. We need Medicaid now more than ever. Every day that goes by that the expansion is not passed, the situation becomes more dire and more urgent for the community.
Amen. Amen. Amen.
Yeah.
Yeah, I think I really appreciate you putting that urgency with us, Renee, because I think that those of us who've been watching this play out over the last few years could not have predicted the position we're in now, where we don't have Medicaid expansion and we do have a global medical emergency, and we just don't have the tools that we need to actually address it appropriately. Thank you so much. Thanks to everyone else for their remarks. Corrine, you're with us in the room. If you have questions you'd like to ask, you get first dibs.
Thank you. I wonder have any of you been in contact with lawmakers about whether they're even planning on talking about this tomorrow, or what their plan is, whether it's Democrat or Republican? Has there been any communication with lawmakers on this?
We've heard from some of our friends in the State House that Medicaid expansion is not on the agenda for tomorrow. Is that right? Is that still right, Sarah? Last week it was my understanding that it's not.
As well.
That it is not on the agenda for tomorrow.
Yeah, I think that is true. And it could be. So what Renee's saying, 24 hours, 12 hours, 2 hours, you could get this done. This is work that they could get to.
Mm-hmm.
They're choosing not to is on them.
Yep. I'd like to echo what Renee said. Cash up front for healthcare is cruel. Yeah. It really is. It's cruel what we're witnessing in our legislature right now.
Corrine, do you have
the deal was done? I don't understand.
Yeah.
It was done. What could there possibly be left to discuss? Mm-hmm. Just get it done.
Mm-hmm.
Any other questions for us, Corrine?
I know if Renee wouldn't mind, having worked with the homeless community and really hearing their stories, you talked about specifically to the coronavirus and getting those pre-tests done and things like that. Have you heard from any of them just struggles they've had even before the coronavirus of just simply getting healthcare access. Is that a common thing that you hear, having worked with the homeless community?
It's a huge problem. We have folks in our facility who have serious behavioral health disorders, who have serious chronic health issues that they're managing, and very often medical costs can be a driver of their homelessness. It can be a driver of why they, you know, can't stay stably housed. And we have people in our facility right now who are uninsured, and it shouldn't be that way. It doesn't make any sense to me at all. I'm actually, you know, moved here in September after living in Illinois for a decade, and Medicaid expansion in Illinois has been ushered in a sea change in the types of behavioral health programs that you can run, the type of social services programs that you can run through Medicaid waivers. And there's lots of ways, there's myriad ways you can use the federal dollars available through expansion to serve people in poverty. And in the end, you save yourself money as a community and a state by making those investments, because over time, poverty is so injurious that we end up paying for it in other ways. So I think that yeah, it's been mind-boggling and baffling for me to navigate the emergency shelter environment, working with people experiencing homelessness, and to deal with the long wait times for accessing Medicaid, and the costs of, you know, trying to get people connected to care who aren't insured.
You can
Those are all the questions I had.
Great. Thank you so much for joining us, Corrine. Mary, can you see if there's any on the Facebook stream that people have asked that we may want to respond to, or anything that you want to notice out loud that people have posted about this?
Healthcare and housing are human rights, from Christina. Tara says, my fear is our lawmakers don't have a perspective of what their inaction means for people who are not like them. That's
Amen.
pretty real. And then Rabbi Modi says there isn't enough time to bring a bill to the floor over leadership. So again, we're looking at that handful of people, just a few, barely even a handful of people who are withholding care from our entire state population. And it's immoral, it's evil, it's greed, it's pure greed.
Well, thank you everyone for joining us. I'm going to ask Mary to repeat the announcements she made earlier about other ways that you can be involved with the Poor People's Campaign and Kansas Interfaith Action, and work that we are doing around the state around these issues.
Yeah, so today and the rest of this week, we're asking folks to join in our selfie challenge. Get a piece of paper and write down why it's important to you to expand Medicaid, and use our hashtags, and keep an eye out on our Facebook page. Today, tomorrow, and next week, we'll be in there sharing your stories. It's the most important thing that moves this movement is the people's stories. Tomorrow morning at 7 a.m., we'll be hanging out with our face masks on and safely distancing at 8th and Harrison to greet the legislators as they come in to the building for their one day of work. If you can't be there with us, be sure to call and email and flood those lines, blow up the phones. We need Medicaid expansion right now. And then my one other announcement is about June 20th. Be sure you join us online. Our Poor People's Campaign is going digital with a mass 140,000 people all together on Facebook on one day. We will use the power of love to fight the power of evil. Blessings be. Forward together, not one step back.
Amen. Thank you to everyone for joining us today. We hope that if you saw this on Facebook, that you'll share it with other folks and that you will communicate with your legislators your disappointment that they did not get this important work done yet again. And to join us tomorrow morning if you're able with your PPE on, your masks and your gloves and doing social distancing, but also there to greet our legislators and let them know how important this work is and how much we want to see them do better. And also, how many of you are going to be voting to make the change? Thanks.
Let
everyone.
them know you vote.
That's right. Thanks, everyone.